I know that the subject of the day of the moment is vaccines, but it's important, as the opening speaker said just now, to go back and take everything that is connected with vaccines that is relevant to where we are going. The coronavirus, as we all know, started in China. About January last year, we became aware of it. And we in Nigeria started making immediate arrangements and preparing ourselves. We know that it is an infection that spreads from human to human. It's not carried by animals, it's from human. The origin may have been animal, but human to human spread. And since only a human can carry it into our country, and most likely coming from China, most likely by air, we paid attention to all, among the first countries to pay attention to arrivals, taking travel history, taking measurements at the airport, and working together with NCDC and Lagos State Government, because we're expecting our airports, Lagos Airport, Abuja Airport, as possible entry points. Took a lot of measures which saved us a lot of trouble at the beginning. This is a virus that eventually spread around the world with unprecedented speed. Nearly every country in the world became affected grievously, and we knew not much about it because it was called a novel coronavirus. I was eventually to get the name COVID-19 from the World Health Organization. It became clear that the transmission from person to person was either by aerosol or droplets, which came from sneezing, coughing, even shouting, loud talking. This is important because we need to understand the reason why we insist on masks. Because the sneezing, coughing, which blows the virus into the air, is the cause of infecting other people. And let me say that for those who have done tests, you see that the sample is taken both from your nose and from your mouth, because this virus can be expelled from both your mouth and your nose. So if you wear a mask like this, you are solving half of the problem. The mask needs to cover your nose and your mouth in order to restrict whatever emissions you have and protect the other man. And the other man needs to wear his mask correctly to protect you. I'm saying this because it's important to understand the reason for the mask. And the spread is also supported by close proximity. The more people are gathered together, one person who expels this virus all over the air can easily infect everybody. So when NCDC talks about social distancing, it is that reason, because it's more difficult for a virus to reach you if you are that distance than if you are near me here. And if we are all crowded in a room, the risk of being able to infect many people is also higher. That's why we speak about not only social distancing, but the crowding, staying apart. Finally, there is a need for ventilation. The more air can come in and dilute the air inside, the less the risk of getting infected. So all those are the reasons why we also campaign against people gathering in closed settings in congregations and supporting open air, because there's ventilation and less risk. Now, we also know by now that about 80% of people who become infected with COVID-19 show little or no symptoms at all, but they are capable of infecting others. And that is a serious matter. And of those who have the infection, the symptoms may be just loss of smell, loss of sense of taste, a little fever, feeling a little well, loss of appetite, a little cough, and that's it, and they're over it. 20% may have very severe symptoms. And these severe symptoms can be breathlessness, and an average of 10% of the total may lose their lives. Now, the causative loss is a kind of pneumonia that's peculiar to the COVID-19. And at first it was thought that we cure it with ventilators. Eventually, it became clear that we need high flow oxygen, which is why government has responded with one oxygen plant in every state, and Global Fund is supporting us with repairing all the oxygen plants in the country that are existing that are not functional. So we shall have oxygen sufficiency in the country. Now, the other point to be mentioned is the need for isolation. Isolation is not a punishment. It is because a person who might be infected and capable of infecting others needs to be kept away so that the risk to others is reduced. If you are circulating in the public, the higher the risk of transmitting this germ. So the isolation must be taken seriously, same as the quarantine, because if you arrive from travel and you do not know if you have carried the virus and you are moving around and you have those symptoms, you can spread it. So the quarantine means you stay in your house for about 8 days or so, and if you are free of symptoms, you'll be tested, then you are okay. But if you break the quarantine rule, then you could have infected other people unknowingly. And out of the people, if you infect 10 people, 8 may be without symptoms, 2 will be very, very, very severely sick, and one may die. So there's a reason for people to keep faithfully to isolation and also to the suggestion for quarantine. And then the same reason for saying stay at home, avoid unnecessary travel, because the more you expose yourself, the more you are moving around, the more you are traveling all over the place, the more you are likely to get into the proximity of someone who is infected, who can infect you. And whether you are wearing a mask or not, if somebody comes very close to you, you still stand the risk of being infected, because these viruses and the aerosol are so tiny, they can pass around into your mask. So close proximity is not something that you need to have at all. Now, the other measures that have been taken are lockdown. Now, again, lockdown is not a punishment. Again, it is to reduce movement, people moving around, because the more people moving around, the more the risk of spread. And it has been applied in very many countries. In Europe, it's presently being applied in various countries. You have what they call a hard lockdown and soft lockdown, which are all modulated, because a lockdown has a terrific impact on the economy, on livelihoods, and it really can cause serious embarrassment to families. So it's a very last resort that is taken, which many countries take only when there are very, very serious problems. Now, science has taught us that within 14 to 16, 17 days, even if you got infected, the virus can wear away and you are no longer infectious. So that's the period that generally looked at for treatment. And if you can just sustain the 14, 15, 17 days, you know you are free of the capacity to infect others, and you are able to keep your family safe and keep all your friends and loved ones safe. The other thing we know is that there is no specific treatment for COVID-19. Many things have been tried: chloroquine, hydroxychloroquine, all sorts of things, zinc. Some of them are palliative, some may help you with your immune system, but not really proven, including remdesivir. We continue to try various things to improve therapeutics. What is clear is that there are some medicines that improve the symptoms, that improve survival. But that actually destroys the virus is not very clear. That is what a cure is. A cure is that you destroy the virus and then you are cured. So that is not in contention at the moment. There was a time when it was believed that ventilators will help us, but ventilators have also proven not to be the real thing, but high flow oxygen, which the most of the isolation and treatment centers now provide. The next question is the need. The president signed the public health regulations the other day, in which we talked about wearing masks, social distancing, and so on. The moral behind it is not that we should use police to chase people. It is that we police ourselves and we do peer policing, that we are the ones who have to look after each other. It's just to tell us the direction, that this is what is good for us, that's what is good for the community. So you don't need to wait and say, where is the police? Who is going to enforce this? And unless you see police, you obey. It is upon us, left to us, to police ourselves, police each other. Peer policing. That is actually the moral and the sense behind it. And I want to use this opportunity to appeal for that self-policing and then the peer policing that we are talking about and advising. The tactic of test, treat, trace, isolate are all tactics to reduce the rate of infection. Later on, we shall be talking about the various mutants and variants that are in circulation and what they portend for the future. Right now, the Ministry of Health has a four-pronged strategy. First is to reduce infection, continue to reduce infection, which we have been doing up till now, by infection prevention and control measures, training and retraining of health workers, risk communication, community engagement, continue to preach, and I hope that this very talk we are giving now also spreads around and that people will learn from it. And part of what we also do to reduce infection is supportive isolation and quarantine, which I've already described, and to also monitor travelers at point of entry to reduce importation. That's where port health services come in. That's where screening at a point of entry comes in. We have also built more laboratories to test and diagnose. We started out with 2 laboratories. Now we have over 80 laboratories in the country. We started out with 0 reagents when at that time our only option was to have taken samples to Johannesburg to test. Now we are able to do all our testings here in country. In fact, in every state you can now test. So there's been a lot of improvement in that area. The second strategy is to improve upon the treatment options, which we continue to do. Government is producing a 10-bed, is going to pay for 10-bed ICU in every state and build isolation center in every state to provide the capacity. Right now we have good bed capacity, about 31% at the moment occupancy, so that some space is available. The purpose is to observe those who are isolated, keep them away, and if there are any complications, to pick up the complications immediately and provide treatment so as to reduce the fatality rate. More studies are being done on therapeutics. We are observing what's happening in the international scene. Are there new discoveries? Are there new drugs? We are waiting to see what is new, and we apply them here. Then we are also sustaining routine treatment. Now, too much focus on COVID-19 or too much fear of COVID-19 can lead to a slackening of routine treatment of all hospital cases. That is a thing that has been observed in many countries. There is a reduction in antenatal care. There can be reduction in routine immunization. So, and even reduced clinic visits. We want to counter all of that to make sure that we maintain routine services and that even as we are vaccinating now against COVID-19, normal routine vaccinations will go on. Normal clinic will go on. Normal emergencies will go on. So there should be no reduction in routine care because we do not want to be losing persons or patients to other causes while running away from COVID-19 deaths. So that is very important strategy for the Ministry of Health. The fourth thing is to develop our emergency medical service to be able to respond to persons in distress. We do not have that much of a system in this country for responding to people who have a medical distress. If you are sick in your home, you have asthma, you have a heart attack, you have anything at all, or you had an accident, either a workplace, or you hear of a tanker that is exploding and spilling fuel and there are burns. We do not really have a system that responds to that. So we need to create that system, which we are working on, to provide emergency service to citizens when they need it and where they need it. And that includes responding also to COVID-19 cases. There were stories of persons who are suffering acute symptoms of COVID-19, breathlessness, trying to drive themselves to the hospital and collapsing on the way because they couldn't get there. We do not want a system like that. We want to be able to get a phone call and an ambulance comes to pick up the person or the patient. So we are developing that emergency medical service. Finally, and that is the big thing we are about today, the deployment of vaccines. Now, vaccination started around December in the UK and the US, and is a much awaited, let us say, silver bullet that should take care of COVID-19. But I must give a warning right away that it does not mean the end of all other measures. All the measures I've spoken about now will continue. They will have to continue. We are not going back on the non-pharmaceutical interventions or the public health measures. They must continue so that we continue to protect ourselves throughout the period. As you can see in Europe and America, they are still continuing all these measures. Even despite the inoculation going on, they are still keeping lockdowns in some countries. So we must not relent, we must not get slack. And the vaccination is a very important thing. The history of it should not put anyone in doubt because it was developed in about a year. The shortest it had taken to develop any vaccines before was the vaccine against mumps, which took 4 years. This has taken a year. It is because it is a child of necessity. But all those who have developed vaccines have tried to do a very thorough job to produce safe and effective vaccines. So we can rely and depend on the vaccines that have been provided for use. Now, the strategy for deploying this vaccine will be dwelt on by MPHCDA very soon. But essentially, there are various types of vaccines. There's the mRNA, which Pfizer and Moderna are using, and maybe one or two others. And then there's the viral vector vaccine, which is used by AstraZeneca and also Sputnik. And then the various attempts by different countries, including Nigeria, to produce vaccines. I'll come back to that later on. But what are our sources of vaccines? We have two main sources and a third probable one. The first is the COVAX facility. For those who do not know, COVAX is a facility set up by the World Health Organization, supported by the Coalition for Epidemic Preparedness Innovations, and the Gavi, Global Initiative for Vaccines and Immunization. So they are the ones who came together to get donations from various sources to make up to $6 billion, probably more than that by now, to ensure that there is equitable distribution of these vaccines. 92 countries are covered, low and lower medium income countries, including Nigeria, who will get these vaccines to cover 20% of their population. And this 20% should include healthcare workers, the elderly, and those who are at risk. The second source is the AVAT, African Vaccine Acquisition Task Team, led by the African Union. The chair is the president of South Africa, who have pulled together resources guaranteed by Afrexim Bank to get enough vaccines to cover Africa in a whole of continent approach, so that no country on the continent will be left behind and not be able to vaccinate its citizens. And they give this loan that you can pay back within 5 to 7 years. Nigeria has already opened her account with Afrexim Bank, and we have already nominated someone who is taking part in the negotiations for the strategy of going forward and making payments. We are also in bilateral discussions. The government of India has offered us 100,000 units of their vaccine, made from the Serum Institute of India. And the Russians have offered us also 100,000 vaccines. We do not know whether we are paying for it or whether it is free. We haven't been told yet. But we are also receiving support from MTN that has offered us up to over 1 million doses. And then the support of, as far as financing is concerned, we are hoping to get support from the UN agencies who are creating a single basket fund. We are working on the supplementary budget of the federal government. We have been talking with CACOVID, that's a coalition against COVID-19 of the private sector in Nigeria, who have been very generous. They have supported us all along the way. And also looking at using residual funds, unspent funds from various World Bank loans that Nigeria has been using in the health sector. Now, the strategy for the rollout will be discussed by MPCDA very soon. Now, let me say here that government has been extremely generous and responsive in all of this. Right from the beginning, they provided all the resources that were required. Right from the first day, they asked, how much do you want? And NCDC was given a grant. Port Health Services was given a grant. And since then, they have provided everything. As I've said just now, government has provided one ICU bed, one ICU unit, one isolation unit, oxygen plants, and any other thing that other countries, that were required in the health sector have been provided per state. So we are very well supplied, and we have had no distress from that area. Now, we have also received help from the European Union, from China, from Jack Ma Foundation, from USAID, from India, from the West African Health Organization with which we are working, and they have already mentioned the African CDC who have helped us. So now I would like to invite for a deeper dive into the processes for utilizing vaccines. I would like to invite the Director General of NAFDAC, Professor Adeyeye.